Well, my name is Dr. Chris Koutures. I'm both a pediatric and a sports medicine specialist in Anaheim Hills, California. I've had the pleasure of working with athletes from the high school age up to the Olympic age, working with USA Volleyball, Cal State Fullerton, the Chapman University dance program. The tibia is the major weight-bearing bone in the lower leg, and when the bone gets abnormal stresses, it can have a range of injuries. When it comes to bone injuries, bone stress injuries are kind of like my pen here. If I am bored one day and I start bending my pen, initially it's not going to bend. If I keep applying stress and keep bending the pen will bend more than it should. That's a stress reaction. If I'm really bored and I got a lot of time on my hands, I may end up cracking that pen on one side. That's a stress fracture. If I complete the fracture by ripping my pen in half, that's a complete fracture. So ideally we don't want to get that far. That's why any type of pain in the lower leg probably deserves further evaluation. So injuries to the tibia, which is the major weight-bearing bone in the lower leg, can range from more of a soft tissue injury. That might be overload of the muscles and other connective tissue of the lower leg. We call that shin splints. In all honesty, sports medicine personnel aren't 100% sure what causes that, but we do know it can be a source of pain, again, mostly on the inside of the lower leg. When it comes to tibial stress injuries, any loading, impact, or jumping activity is at high risk. That could be a runner, that could be a ballet dancer, a volleyball player, anybody who's doing landing on the leg. Now you could be in a different sport altogether, let's say water polo or swimming, that doesn't have a huge risk with the sport. But if you're doing a type of plyometric training on the side or jump training, you could be at higher risk. We also know that certain people may be at risk because of weakness up in the hip area. If you don't have appropriate hip control, that puts additional forces on the shin. If you don't have appropriate motion of your big toe or your ankle, that could put more pressure on your shin. If you recently tried to increase your stride length, that might put pressure. So it's not just the activity, it might be the way you're trying to do the activity that can cause problems. Certain habits or technical issues that may cause shin injuries would be too much, too fast, too soon. So you go from a relatively lower level of activity to a higher level of activity pretty quickly, especially if you've not developed the strength in the hip. So if the hip's not able to keep the leg in alignment, it tends to roll the shin inward, and that puts abnormal stress on the shin. Again, trying to increase your stride length too soon, so you're actually trying to lengthen things, could put additional forces on the shin. And then you've got situations where if somebody's not taking care of their nutritional needs, if they're not getting enough protein, enough calcium, if they're not getting enough total calories, that can weaken the bone structure and cause problems. So in cases where there's pain in the shin, you look at a couple different factors. If it's affecting the way you're doing things, you're not jumping or running as well, you're limping, you're not able to finish your workouts, that's a big red flag. If there's pain after a workout, maybe a scale of 1 to 3 out of 10 that goes away within a half hour, that's one level of concern. But if that's pain that continues into the evening, especially the next morning, that's a bigger concern. If the pain is becoming more intense, more localized, or more noticeable in any way with numbness or tingling, that's probably worth getting it looked at. In addition, if you're just not sure, you've got a big event coming up, you don't want to take unnecessary time away and you want to have a better handle, get it looked at.